hear and absorb. But as a faculty, if we are going to say, so generally they used to think like that. So general regular classwork.
Right.
They may not take it to the right direction. Yeah. So that's what we have planned. And this pharmacy practice department people, they did a good job.
Yes, really, sir. Narayan sir, Mohan sir, their contribution to this seminar, it's really appreciable, sir.
Yeah.
Yeah.
With short notice, they have taken all the pains and they have arranged this excellent 3 days webinar series one.
Really, I thank to all the resource persons, sir. Even though they are having a hectic schedule, they arranged some space for us, sir. Really.
No,
Sunday it should be very hard, but Sunday is fine.
No, that's the beauty of alumni. Always,
Yes,
any institute alumni will always don't say no.
Yes, sir. Yes, sir.
So the only thing is, like, even if one student is benefited from this, we'll be happy, sir. That's all we need.
Not once.
No. I'm just saying. No, I'm just saying. Out of 200 students, 300, even one student got benefited out of this session. That's more than enough, sir. Yeah.
Even Tarun, from our Raipur also, some students are planning for US. Now they are completed IELTS. They are planning to come US.
Sir, I would suggest than IELTS, TOEFL works better, sir, for US.
IELTS, TOEFL, okay.
No. IELTS is not required for US. IELTS is required to enter into US through a master's program.
Master's course.
Once you are here and you want to step into the pharmacist licensure program, then IELTS doesn't count. The only thing counts is TOEFL. And I'll go in detail in the slides. So
sure.
Yes, sir. And I'm not going to cover anything that Avani covered. And I also gone through the lectures from the Canadian speaker. And I'm not even going to say all the points because Canada and US kind of have the same rules in pharmacy job. So it's almost kind of same, but the laws and regulations will vary a little bit. That's the only difference. So whatever they missed, I'm going to cover in this session. That's it.
Good. That's good. Yeah.
Because I have gone through all those lectures and then I finalized what I should. So
what's the timing right now there, Tarun?
Right now it's 11:35 in the night.
11:30 means it's morning or
11:30
night.
It's Saturday night 11:30 for us, and it's Sunday morning 10 o'clock for you.
Okay.
Yes.
Okay, fine. So.
And I see that Canadian speaker and Sudhiranna, our senior, and also I did go through Avani's. All three did a really good job, sir.
Sahiti?
Yes, sir.
I think you can start now.
Yes, sir. So good morning all the participants and the panelists for joining us on Sunday for 2 sessions. So today we are having our first speaker, Dr. Tarun Krishna from US. He's working as a registered pharmacist in telepharmacy, Christus Brown Hospital, Texas. So before going for the session, I like to give a brief introduction about Tarun sir. Tarun sir has completed his PharmD postbaccalaureate in Raghavendra Institute of Pharmaceutical Education and Research, Raipur, Anantapur, and then he has completed his Masters in Public Health from University of Illinois, USA, and then he has joined as a clinical pharmacist. He has working as a clinical pharmacist with hospitals where he is going to have a direct interaction with the physicians and the patients. And third is also having experience of as a chemist for Illinois Environmental Protection Agency, where he analyzed environmental samples and developed some SOPs and certified as analyst for potable and non-potable waters. And third is having a lot of knowledge and experience working as a pharmacist as a registered pharmacist in USA, where he emphasizes the importance of knowledge on medication therapy and clinical expertise, which will be very helpful in practicing as a pharmacist in US. So with this brief introduction, I hope Tarun sir will give us insights about how to develop our skills which are required to practice as a pharmacist in USA, and also how to approach for being a registered clinical pharmacist in US. With this, I invite Tarun sir to start the session.
Hello everyone, I'm Tarun Krothapalli from United States. Let me open my slides. Can I share my screen, sir?
Yes, sir.
Yeah, so you can share.
Before starting, a small announcement to the participants. You can post your queries in comment box in YouTube, which is going live there. And also you can post your queries in Q&A box, which will be forwarded to the speaker by the moderators. Thank you, everyone. Tarunana, you can start.
Okay, everyone, today's topic is going to be specially focused on the United States Registered Pharmacist Licensure. So if you all can see this picture, it shows a long path of road. I can hear some other voices.
Yeah. Sir.
Tarun, you can continue. You can continue, Tarun.
Okay, so if you all can see that image in the screen, it shows a road which is long path. So that's how the pharmacist licensure journey is going to be. So I would say be prepared, and if you are really interested in it, then only you should start this program. Or it's no sense in doing it. It will kill your time and money as well. So let's dive deep into it. And okay, so your pharmacist dreams will absolutely come true, but the only thing is it will take time and your 100% dedication, and you need a lot of patience, because this process it's not going to be done overnight. Let me give you my example. I came here for master's and I did my master's for 3 years. While doing my master's, I did finish my FPG's exam and TOEFL. And then by the time I come out from my master's, I'll have a work permit. Once you finish your master's program in the United States, you will be approved for a work permit for 1 year for STEM courses and 3 years extension. And for non-STEM courses, it's only a 1 year of work permit. So I did public health, master's in public health. So public health doesn't come under STEM course. I guess Avani had explained a lot more about STEM and non-STEM courses. So public health doesn't come under non-STEM courses. So I only have 1 year of work permit. So I have to finish my work internship in that 1 year. So in order to go forward on my further steps. So after finishing my master's, I did my internship, and then I cleared the next 2 steps, which are NAPLEX and MPJE. And then I have to do some compounding exams, and then you will get your pharmacist licensure exam. So it's not going to be done overnight. It's takes at least 2 to 4 years, including internship and exams. So you better take your time, be dedicated, and have some patience for it. Okay, let's move on. Okay, the contents in this session, I'll give you an overview about Pharmacist Life, and I will tell you something very important about NABP, which stands for National Association of Boards of Pharmacy. and state boards. So in United States, there are two governing bodies which control the pharmacy profession. One is National Association of Boards of Pharmacies and individual states. So, and next I'll tell you deep about FPGE exam, which is Foreign Pharmacy Graduate Equivalency Exam, and TOEFL, Internship, NAPLEX, MPJE. NAPLEX, MPJE are the steps which you do once you are done with your internship. MPJE is kind of pharmacy law exam, which is specifically related to federal and state laws and regulations. And finally, I'll tell you the pharmacist job responsibilities and what I personally do in my work. Okay, let's go to the pharmacist life. So the pharmacist life in United States, you will be greatly respected for your profession. So you will have your respect everywhere. Patients and every other common man will give you equal importance as doctors. And so that's the main thing. So we need to be respected. So that's what you get once you become a pharmacist. And you will have occupied work. So your daily typical work schedule will be occupied. So once if I go to work and if I see time, it's already noon. And if I see the time again, it's time to go. So I don't even know how time passes by in the work. So that's how it is. And then pharmacist also pharmacist has the primary role in patient safety. With that, he will be able to make a difference between other healthcare professionals and nurse practitioners, doctors, techs, and everyone. And pharmacist is also considered as one of the important member of healthcare team. And as being a pharmacist, I have developed a lot of relationships with patients, and that's the major part. That's the major thing, and it's the best thing. And you will have flexibility in career, like you can work in community pharmacies, but community pharmacies will have a lot of physical stress. But if you work in hospitals, you will have some less stress, but you will be more liable to the patients. And of course you will have a rewarding salary, and you don't have to worry about salary. It will, on an average, you will start around 120,000 K. So that's an average, and you can go up to 250,000. So there is no limits if you own a pharmacy and if you are even onto business. So the salary is the best thing. And you will also be honored to be a part of major innovations in medication therapy. So for example, like we will have something called Pharmacist Alert. So we get everyday mails from different pharmaceutical companies and everywhere about the new drugs, new treatment guidelines, or if there is any recalls about the drugs. So on and so forth. Okay, so it's all about the new innovations in the market. You will be on top of it. Okay, next, moving on, the go-to place is nabp.net. So whoever wants to be a pharmacist in United States, the first website you should visit is nabp.net. It will have all the information from the step one all the way to the time you are a pharmacist. Everything will be there in that website. And I will personally show it to you. And just I want to give you a brief glimpse on the NABP. It is a body which ensures the public health and safety by providing the pharmacist license and also transfer. When I say transfer, if you are a pharmacist, let's take me an example. I'm not pharmacist in entire United States. I'm only pharmacist in Texas, Illinois, and California. That's it. So if you have to work in whatever state you want, you have to be licensed in that particular state. So that's where the transfer comes. I have to transfer my license from Texas to Illinois, Illinois to California, so on like that. And it also governs the competency assessment programs, like continuing education programs. So pharmacist's job is like ongoing process. You have to do like continuing education credit hours, and you have to submit that to the board every 2 years. So once you get the pharmacist license, it expires in 2 years. So you in order to renew your license, you have to do the continuing education hours, and you have to submit, and you have to also pass a small exam. That's not going to be tough, but still you have to pass the exam. And NABP also governs the verified internet pharmacy practice sites. Like it governs the telepharmacy. I'm going to show you more in detail about that. So whatever the pharmacy services you are providing through internet, so this NABP is also going to look after that. And then it also deals with the wholesale distribution of medicines in United States, and also DMEPOS, which is basically for medical devices like IV injections, wheelchairs, the saline bottles, and polyethylene glycol levels in that bottles. So basically it's all about the medical devices and those. And that's an overview about National NABP, National Association of Boards of Pharmacies. Let me also take you to the website so that you can have a better idea. So this is the website. It will, in this website, you can find basically everything. So if you go to nabp.net, and if you go to programs, and I also want to give you a small suggestion: before you start anything, you have to create your NABP e-profile. So you can track all your process in your in e-profile. Okay. So if you go to programs, you will see everything about all the services, like the transfers, NABP passport. So NABP passport is something new. It started after COVID-19. So basically what NABP passport is, if you apply for this, you will be a pharmacist in almost 26 states, which are participating in this program. So this is a good opportunity because of COVID. And it also, it has everything about the NAPLEX, MPJE, FPGE. The rest PCOA, these are for the students who are going to the PharmD program in United States, and you will get all the information here about the NAPLEX, FPGE, pre-FPGE, pre-NAPLEX. Like pre-FPGE and pre-NAPLEX, these are something exams which you take before sitting for FPGE or NAPLEX, just to test your ability and how well you will do in the exam. If you pass pre-FPGE and pre-NAPLEX, you will definitely pass the FPGE and NAPLEX and MPJ. So, but you should have to pay for pre-FPGE and pre-NAPLEX. It's not expensive, kind of $50 for one exam. And it won't be like an actual exam, but you will only have 50 questions. But the grading is similar to the actual exam. So if you clear the pre-NAPLEX and PFPGE, you will definitely clear the NAPLEX and FPGE. So not only that, so you will find everything about like compounding, pharmacy accreditations, pharmacy website, home infusion therapies. Whatever you want to know about the pharmacy in United States, this is your go-to place, and this is your go-to website. This is where all you can gain the knowledge. And let me show you something. Let me go back to the slides, and we will come one by one. Okay. Okay, let's start with FPGE. So FPGE is Foreign Pharmacy Graduate Competency Examination. So this examination is offered only once per year. That's in fall. Fall is somewhere between August and December. That's called fall. Before, this used to be in two, before it's offered twice, in spring and fall, but now because of the too many foreign graduates, they changed it to once per year. And the test format is kind of it's a very big test. Like you will have around 250 questions, and the test is of 6 hours, 6.5 hours, with an half an hour voluntary break. So it means if you want a break, you can take it. So be prepared for the exam. It's going to be a long exam. So I would definitely suggest you, don't be scared seeing the questions. Out of 250 questions, you will have 50 experimental and research oriented questions. So they will see the ability of students, let's say those 50 questions will not count into your exam. So they are only for the future purposes. So don't be shocked or anything by seeing strange questions in the exam. They are just an experimental questions, just 50 of them. But you won't know which 50. They will just be a mixture. So it might be anywhere from 1 to 50 or 200 to 250, anywhere. So, but that's the test format, 6.5 hours, 250 questions. It's a long exam, believe me. And next is the candidates who are applying to the FPGA after January 1st, 2020. This is a new requirement. They must pass TOEFL before sitting for the FPGA. This requirement doesn't apply for the application submitted before the date. So this is a new change. So you have to clear the TOEFL first before even sitting for the FPGA exam. And the most important thing is TOEFL, which you took in India or whatever country it is not valid. The TOEFL you have to take only in United States site. So those tests is only valid. Let's say if you already passed TOEFL in India with a very good score, so but still that will not be considered. You still have to take a test again in United States. So that's one of the bad thing. They do that because in most of the countries, you know how they take the TOEFL exam, you know. So that's the reason. And next, the other requirements, if you are graduated before 2003, you are eligible with a B Pharm degree. But if you are graduated after 2003, you should have a 5-year degree. So this 5-year degree, I'll go in detail in the next slide. 5-year degree, they will say 5-year degree, but it all depends on the credit hours, how many you have. So let's say, for example, if you have a B Pharm degree and if you have pharmacy practice masters, then you will still be eligible for FPGA. So they will basically consider the credit hours you have. I'll tell you how they will consider your Indian transcripts from the credit hours here. I'll go deep in the next slide. And next, once you clear the FPGA exam, that certificate will be valid for 5 years. So that means within that 5 years of time, you have to finish your NAPLEX and also MPJE, also internship. If you don't finish any of these steps, this FPGA will expire and you have to take it again. And you only have 5 attempts. So in life, that's lifetime. So in life, you can only take 5 times. If you fail 5 times, that's it. You won't be able to take it anymore. And you have to drop your dreams as a pharmacist here. Okay, next moving on is education credential evaluators. This is where you break down your transcripts into American credit hours. So basically what this agency does is they will break your transcripts into American standard credit hours. And they will see if you are eligible and if you are equivalent to American standard PharmD course. If you are eligible, then the EC will give an okay to NABP and then they will consider your application. And these are the required stuff you need to send to the ECE, your official transcripts, which should be sealed, and a proof of degree and photocopy of your pharmacy degree. And you also need you should be registered in India first as a pharmacist, whatever the state, it might be either Andhra Pradesh, Tamil Nadu, whatever. So first you have to register there, and that certificate is also needed here. And in ECE, there are 2 types of evaluation, general evaluation and course by course evaluation. But for the NABP purpose, general evaluation should be good, and this will cost you around $120. I'm not sure if there is any changes right now, but when I did it, it's $120, but I actually did course by course evaluation, and that will cost you $160. So it will interpret each course. Let's say if you did pharmaceutics in India, it will give you credit hours, like your pharmaceutics will be considered as 4 credit hours in here. So, okay, those 4 credit hours are good enough for FPGA exam. That's how they interpret. your transcripts. So that's all they do as ECE evaluator. Okay, next coming to the fees for an FPGA application, it's $550. And to sit for the exam, it's $650. If you fail for the first attempts, second time you have to pay only the $750. You don't have to pay $550 again. So that's it. So, and third time 750, from the next time you'll only pay $750. So the examination costs are not really expensive, and I would not recommend you to take any courses that are offering online. It's always best to prepare from the books. I will suggest you some books. Those books are more than good enough. If you think you need someone's help, there are also some students like who are already passed out and they're pharmacists. They give some training on this exam and they'll charge you around $1,000 or something like that. But I would definitely say that more than preparation from the books is more than good enough. Next, moving on, the FPGA examination, you will have 4 parts. Basic biomedical sciences, and that's 10%, and pharmaceutical sciences, 33%, social, behavioral, administrative sciences. So if someone is coming here for Master of Health Administration or Regulatory Affairs, so this 22%, it will help with those masters. And I can say that social, behavioral, and administrative questions in the exam will be like a general questions. You can answer based on the common sense. And this, I would say to concentrate more on basic biomedical sciences, pharmaceutical sciences, and clinical sciences. And also the one more important point is you have to pass each and every section. Like let's say if you pass pharmaceutical sciences, and if you don't pass clinical sciences, you are still failed in the exam. So you have to pass each and every section. You have to pass all 4 sections. That's one of the thing. The only reason they do is they want you to know each and everything about a patient and what's going on, about the drugs, everything. You should know each and everything. So that's the reason you have to pass all the 4 areas. Let's moving on to the biomedical sciences. They will concentrate mainly on physiology, biochemistry, microbiology, and immunology. I'm only going to give you a glance because the FPG syllabus will include the entire syllabus from Form D first year to the time you finish your 6th year. So it's very hard to put everything on the slide. So when coming to the physiology, they will ask you a lot about anatomy and pathophysiology and like that. And biochemistry, they'll ask you more about chemistry of lipids, fats, amino acids, enzymology, like that. Microbiology, they'll go specific about like the organism and the disease caused by it. For a small example, they'll just ask you what are the primary organisms that cause strep throat, and there will be options staphylococcus, streptococcus, like that. So you'll obviously choose streptococcus for a sore throat or strep throat. So that's how it is, like organism and disease specific questions, like microbiology related to human diseases. And immunology, you should definitely know about the hypersensitivity reactions and how different antigen antibodies. And now they are mainly specifying on the intraleukins because that's a major part of treatment nowadays. So these are the major topics you will encounter in the exam when you are with the questions. And pharmaceutical sciences, they will include medicinal chemistry. I will say half of your exam will look like medicinal chemistry because they concentrate more on this part, because most of the drugs, they are like a chemical compounds. So they really want you to know in depth about medicinal chemistry. Like they'll ask about acid-base reactions. They will give you drug structures, like they'll give you digoxin structure, they'll give you neostigmine structure, and they'll give you like some penicillin structure, and they'll ask you to find what drug it is. And let me give you one good example for SARs, like structural activity relations. They'll give you a benzodiazepine structure, and they will ask you at what position if you add hydroxyl group to increase the activity of the drug. So if you add an hydroxyl group in third position of benzene ring, obviously the activity of those benzodiazepines will be increased. So the questions will be in that way. So, and that's how the medicinal chemistry. So I would say take special focus on medicinal chemistry, then that's very important. You will see a lot of questions in the exam from medicinal chemistry. And next, coming to the pharmacology and toxicology, I would say your go-to place for pharmacology is Lippincott. Be thorough from first page to the end. You should go through entire book. You won't believe I read entire book of Lippincott. AFA, I will show you guys. Let me show you. This is a book called AFA. This is for FPGE exam. There's Lippincott and CPR. You guys should already be aware of CPR, Comprehensive Pharmacy Review. That is very important as well. But for pharmacology purpose, I would say Lippincott is the go-to. And coming to toxicology also, they will ask you the same questions like acute toxicity and chronic toxicity. For example, like if you take, they will, if you drink alcohol, what are the acute toxic, what are the acute symptoms like blurred speech, like that. And if you take the chronic effects, hepatic failure, ascites, like that, they'll go in depth, like, and they'll also go in depth on organophosphate poisonings, and also barbiturate poisoning, vitamin K, warfarins, blood thinners, like everything that is toxic to your body, they'll focus on it. Coming to pharmacognosy and dietary supplements, that is also very important, because in United States, most of the patients, they prefer over-the-counter products. That's where pharmacist plays a major role in the pharmacy as well. You have to give a lot of suggestions to them to choose which over-the-counter product suits them. And also you have to tell their lifestyle changes and dietary supplements. You have to give suggestions on all those. For example, let's say if a patient is coming to your pharmacy and asking something about garlic, because it's famous right now with the COVID. So you can tell them that you have to always see the history and tell them if he's taking any blood thinners. If you all know, garlic causes bleeding, but it is also helpful for the hypertension. So you should consider all those factors, and you have to suggest the patient in a right way. So that's the thing for pharmacognosy and dietary supplements. And if you next going to pharmaceutics and biopharmaceutics, I would say the book I used for this is Brahmankar. That's really a great book. If you go through that book, it's more than enough. Also for pharmacokinetics. And next, coming to pharmacogenomics. Oh, I'm sorry. In pharmaceutics and pharmacokinetics, they'll specify and focus on IV bolus drugs, IV infusions, loading dose, maintenance dose, and you also have to calculate the drug doses based on hepatic clearance, renal clearance, patient's hepatic condition, and many other factors. That's how they focus the questions on. And next, coming to the pharmacogenomics and genetics, that's a booming topic in United States right now, because right now most of the physicians and healthcare professionals, they are going gene-specific treatments. Let's say, for example, I can give you, if you all know about HER2 receptors, which they test for the breast cancer. And if they have that HER2 receptors or HER2 genes in their body, they always prefer trastuzumab, which is a treatment for the breast cancer, like that. And also the other example is ARDB2 gene for asthma. So like for patients who have asthma, they will go check for the gene if they have it. So if they have that gene, so they will change the treatment rather than just prescribing the SABAs and LABAs. So SABAs are short-acting beta agonists and LABAs are long-acting beta agonists. They will go genetic therapy, like there is some drugs called Nucala. Those are in the US market. I'm not sure if they are in the United States market. So that's how they choose the treatment based on the patient's genetics. So that's very important topic in the exam as well. And of course, sterile compounding and non-sterile compounding. I would say sterile compounding and non-sterile compounding, it's only fundamental, like you just have to know about the basic dosage forms, like oral solutions, their properties and everything. They don't go in deep, but they'll go in deep in the compounding when you are taking NAPLEX exam. So that's how it will be in the FPG. So it's only fundamental. Next, moving on to social, behavioral, and administrative sciences, you will see something called healthcare delivery systems. This will be a new topic for you. You will start learning about this once you are in United States. So healthcare delivery systems are something called HMOs and PPOs. So HMOs is health managed organization and PPOs is point provider service. So it's about like patients who have HMOs, they can go to any doctor. Let's say if I have HMO, I can go to any doctor in Texas. But if you have a PPO, like preferred patient, preferred provider. So preferred provider means like a doctor. So you can only go to one doctor. So you should know about all those healthcare delivery systems. And also like in United States, there is like Medicare and Medicaid. You should also know a lot about that because that's all you deal with every day. So Medicare is something related through federal. It is a kind of federal insurance, and they categorize the payments, like Medicare Part A will pay for the hospital, Part B will pay for the medical, Part C for the devices, and Part D for the prescriptions. So you need to know more about Medicare and Medicaid if you want to clear the FPGE exam. It will all be there in the AFA book. It's called American Pharmacist Association FPGE Review. You will find everything about there. I don't think you will see all this information in India. And also about public health, population-based care, and pharmacoepidemiology. I'm not going to go in deep in here because I guess my friend Avani had covered a lot about this, but pharmacoepidemiology is also one of the important. I would say everything is important for this exam, whatever you see here. And next, economic and humanistic outcomes of healthcare delivery. This is where your pharmacoeconomics comes into play. And I'll give you a very good example for cost effective alternative in the next slides. So that's what pharmacoeconomics is. You should know about cost utility, cost benefit, cost minimization, all those studies. And also about humanistic outcomes like quality of life, how the patient life is affected due to medicines or disease, like those. And pharmacy practice management, I guess Canadian speaker had covered a lot about it, so I'm not going to go deep in there. And coming to pharmacy law and regulatory affairs, here you have to know about the American pharmacy law. Like you have to know about the federal laws. That's what they concentrate in FPG. So you don't have to know about the state laws, but for the FPG, you have to know about the federal laws. Like you need to know about the Food and Drug Administration, USDA, which stands for United States Drug Enforcement Administration. That deals with a lot of narcotics and controlled substances. You need to know about their prescriptive authority, dispensing authority, everything that's related to Drug Enforcement Administration. And regulatory affairs is also covered by Avanindra Reddy. And next, coming to the biostats. Biostats in FPG is just like superficial. You just have to know the basics. Like you just have to know what is a case control study, cohort study, and you should know something about the central tendencies, means, medians, mod, range. It's a basic, but biostat is very important in nabplets. And next, coming to the ethical decision making, they will ask more about ethical dilemma and conflict of interest. Conflict of interest is something like if doctor might prescribe something and I might think it's not appropriate for the patient. So that's where the conflict for me and the doctor comes. So we have to choose, we have to make an ethical decision at that point. And you also, they will ask you about the professional communications. Professional communications is it's the general questions you can answer based on common sense. And the next important topic is medication dispensing and distribution systems. They will focus specially on the automated dispensing systems, central stocking, floor stocking. Like central stocking is something central stocking is something that you store all the medicines in a central warehouse in the pharmacy, and then nurses come to the central dispensing station and they take the medicines and they go into the patient wards and then they dispense it there. And the next one is floor stock. Floor stock is like in a hospital, if there are like 5 floors, that's an example. So you will have 5 different pharmacy stations in each floor, and you will only be taking care of the patients in that floor. That's what the floor stock is. And nowadays in United States, they also started automated dispensing units where those automated dispensing units will be, it's kind of a locker box where they leave it outside the hospitals or pharmacies everywhere, so the patient will have their own access to the lockers and they can come and just simply take their medicines. We will include the patient counseling points. We will print out everything, the warnings, precautions that needs to be taken and everything. So those are called automated dispensing units. So they'll focus more on that. And next, coming to the clinical sciences, evidence-based practice. That's the key for clinical sciences. So they will ask you all the questions based on the guidelines. So you have to follow the guidelines. You cannot simply treat the patients with the drugs. You have to follow the guidelines in here, that's for sure. If you violate the guidelines, you will be liable for that. So be careful and concentrate more on the guidelines. For example, for diabetes, you have to follow the American Diabetic Association guidelines. For heart, I'll show you more in the coming slides. So basically, that's what it is. You have to base your treatment based on the guidelines. Clinical pathophysiology, clinical pharmacokinetics, clinical genomics, I already gave you an example. So it's all about the same thing. There they will ask about the bookish knowledge. In the clinical part, they'll focus on the patient and on the treatment. And next, coming to the disease prevention and population health. In the prevention part, there comes the immunizations, vaccines. So you should have thorough knowledge on vaccines and immunization, because 60% of vaccines and immunizations in United States are done by pharmacists. So they'll focus more on it. So you have to know all the timelines. Let me give you an example for pneumonia vaccine. So let's say for pneumonia vaccine, in United States, it comes in 2 doses. If a patient is under 65 years old, you have to give first dose, and within 1 year, after 1 year, you have to get your second dose. But if the patient is older than 65 years, then they have to get the first dose today, and their second dose will be in 8 weeks. So once they get their second dose, they are good for 5 years. So that's how you need to know all the timelines, and also different immunization dose. Let's take a small example of flu. So in United States, there are 3 different flu doses. One's for the kids, one's for the adults, and one's for the geriatric population. So for the kids, it's 0.25 ml of vaccine, and for the population older than 65 years, you have to give high zone flu dose, which is a concentrated one than you give it to adults and the kids. So that's what basically it is. You just have to know in detail about the vaccinations, timelines, and the preventive steps. And I'll also give you one good example for the prevention in the coming slides. And patient assessment. Patient assessments here, they concentrate more on the laboratory values. Rather than you should know the basics on the laboratory values, but they'll go in depth in laboratory values in the NAPLEX. So, and also clinical pharmacology and therapeutic decision making, the good book is Lippincott. If you are thorough in Lippincott, then you can do the pharmacology. I would definitely say that. Next, moving on to the TOEFL. Here comes the tough part. So I also want you to remind guys again, now you will be applying from this point. So you should take the TOEFL first, that too in United States. And these are the scores. Reading, you should get 22, listening 21, speaking 26, and writing 24. These are kind of tough scores compared to Canadian IELTS exam. In IELTS exam, you should only get 6.5 in all bands. So 6.5 in reading, 6.5 listening, 6.5 speaking, and writing 6.5. But in here, you should get 26 in speaking, is kind of 8.5 band in IELTS. So that's where the toughest part is. And the writing, you have to get 24. That's equivalent to 7.5 in IELTS. And 22 and 21 are kind of close to 6.5 like IELTS. But TOEFL is the toughest exam. Believe me, I took 6 times. I cleared my TOEFL on the 6th time. And there is a reason, because it will take multiple times, because you must clear all 4 sections in one testing session. Like if you pass reading in one session and if you fail speaking, then the test won't be considered. You have to pass all 4 sections in one testing section. That's it. So in my first session, I cleared reading, listening, speaking, and I failed writing, then it's gone. I have to go for the second test. And then I cleared reading, listening, and writing, and then I am not able to clear speaking. So you have to pass all 4 sections. That's the worst thing there. And once you pass TOEFL, that TOEFL score will be valid for 2 years, and you have to clear the FPGE within the 2-year span. If you don't clear that FPGE within 2 years, you have to go back and take the TOEFL again and then come back to FPGE. And there are no limits for the TOEFL exam. You can take as many as you like. I see some students, they took almost, I have one of my friend, he took 13 times and he is still taking. He's going to take his 14th time in next week or so. So TOEFL is one of the toughest part in this steps. And next, moving on to internship. Once you clear FPGE and TOEFL, then you will be eligible to work as a pharmacist intern here. And getting the internship is also not an easy task, but it's possible and doable. If I can do it, everyone can do it. So I would say for internship, you should have a strong academic background and you should have a proper work permit. So let's say if you get a job and if you don't have a work permit, then there is no sense. You should already have a work permit. That's the reason I said, while I am doing my master's, I cleared my FPGE and the TOEFL. By the time I graduate, I will have the OPT program, which is optional practical training that will help you as the work permit. So you have to, that's where you need the planning in this as well. So you should do in such a way that you should graduate with your FPGE and TOEFL scores. So by the time you come out, you will have work permit and then they can hire you as an intern. So that's how you're supposed to plan. And next, you should have an appreciated FPGE scores. FPGE test is for 150 points. You should get at least 75 points in order to pass the exam. So how they evaluate your pass score is kind of tricky. They don't even let you guys know. But any score over 90, like let's say if the passing score is 75, and if you have more than 90, and they will definitely look into your profile. That's one of the key. And prior experience, and they will also ask you about the prior experience back in India, or the prior experience you can also get as a tech. Okay, techs, coming to the techs, what you can do if you are having a hard time to find the internship, you can join as a tech, like a pharmacist tech. So for this tech, you also have to clear an exam. But that exam is not so hard. If you can study for 2 to 3 days, you will get you will be able to clear the tech exam. So once you clear the tech exam, you can go join in the pharmacies as a tech, because they will easily hire you as a tech rather intern. They'll think a lot if they have to hire you as an intern. But to hire you as a tech, it's very easy. So that's how you step into pharmacy. And then they will know your ability, your quality of work, how your enthusiasm in the work, and your professional relationships. And then you can ask them for the internship. That's the thing. And also you should be flexible to adapt. Like if you get a job as a intern in a hospital, you should be able to work overnight. Like the shifts are long. Just last Friday, I have to work from night 10 to morning 8. It's kind of a tough job at that time. So you should be flexible with the hours as well if you are willing to work in hospital sector. Uh, and that's one thing. And also you should be smart and quick. You will have a lot of work all day. I would say I have to give my priority in the work to the patients who really need. So that's how busy you will be in the pharmacy. So you should be very smart, and you should be quick in the sense, again, if you do mistakes in dispensing, and it will be a problem again, and your preceptor will not approve your intern hours, and you should submit many other documentations for that. So you should be smart and quick. So these are if you have all these things, then they will definitely hire you as an intern. And next, as an intern, a pharmacist intern will perform the duties under a pharmacist, under the direct supervision and he's also called as a preceptor. So you should sign up with the whatever the Texas board, or whatever the state you are doing your internship. Your preceptor should approve you that he is taking you as an intern, and you should communicate with the Texas board, and they will start calculating your intern hours. And you should always be in a direct supervision. Let's say if you are working in a pharmacy, and if the pharmacist step out of the pharmacy, and you will turn as a tech, you are no more intern. You are only intern when there is a pharmacist. And next, coming as an intern, you will gain a lot of experience by assisting the pharmacists and pharmacy team, and following state and federal regulations. And you can work in community pharmacies, hospital pharmacies. LTCF is something called long-term care facilities. You will see those a lot in United States. And managed care. So managed care is for like chemo patients, for the oncology. So it's specific for diabetes patients. So like that's what the managed care is. And you can also work under a prescriber. If you know any doctor or anyone, you can also work under a prescriber as a physician assistant. So those hours will also be counted. And you can also work in army. In army, this is only when I came in, when there is Obama administration. But as long as with the Trump administration, now you cannot work anymore in army as an intern. He doesn't want the foreign graduates to do that. So now you guys don't have that option. And next, coming to the salary, believe me, you won't have a good salary as a pharmacist intern. You will just have some basic salary. It's the same thing even for the doctors, who are doing their residency, they will only earn $2,500 a month, and pharmacist intern will earn around $1,000 to $2,000. That too, if you find someone who is willing to pay. But if they are not paying, you might, if it is really needed, you might also have to work them for free. So be even prepared for that. So that's that about the salary. And next coming, okay, once you're done with your internship, then you will be equivalent to a student who did his PharmD in United States. So once you completed your FPGE, TOEFL, and internship, now you are equivalent to the student who did his PharmD in United States universities. And next, coming to the NAPLEX. So after finishing your internship, you will be eligible for NAPLEX. But some states, for example, the state where I am, Texas right now, in Texas, you can take your NAPLEX exam while you are doing your internship. That's one good thing with the Texas state. And also Oregon does that. And there are 5 or 6 other states that allows you to take NAPLEX exam while you are doing your internship. Unlike FPGE exam, NAPLEX is available year long. So it's available all year. Let's say if you fail your FPGE, you have to wait a whole year to retake the exam. But it's not like that in NAPLEX. You can take it next month, next week. It's all there for you. And the test format is also similar to FPGE. You will have 250 questions and 50 experimental questions and 6.5 hours exam with a half an hour break. So it comes to around 7 hours. So that's the same test format. Some of my friends told me that they recently changed the test format to 200 questions because patients are appealing that it's a kind of long exam and it's strenuous. So I'm not really sure about the change, but when I took the exam, it's 6.5 hours with a half an hour break, total of 7 hours. Same thing like FPG. And validity, NAPLEX is valid for 5 years as well. But in order for it to be valid for lifetime, you have to clear MPJE and you have to be a registered pharmacist. If you don't do that, your NAPLEX exam will expire in 5 years as well. And the same thing, 5 attempts like FPGE, if you don't clear it in 5 attempts, I have one of my friends, she cleared in her 5th attempt, the NAPLEX. So it's very hard, but she tried, she put her effort and she's really dedicated. So she's finally cleared it in her last attempt and we really prayed for her exam. And I would say NAPLEX is one of the great exams I have seen in the pharmacy profession. And the only reason I say that is it's great because you will gain a lot of confidence once you clear NAPLEX. So until I clear my NAPLEX, I'm not really confident about patient safety. But once I am done with my NAPLEX, I got confidence that I'll be able to go and work in a hospital. So that's why I say it's a great exam. I really love that exam. And also you will learn a lot of things which you have never learned in a treatment. And it is mainly focused on the patient chat. So out of 250 questions, 200 questions will be on the patient chat. So they will give you the patient past medical history, kind of soap notes, what we do in PharmD. So they'll give you the patient medical history, past history, laboratory values, and the medications patients is taking, and they will ask questions based on that. So for example, they'll give you a list of medications that patient is taking and the lab values, and they will ask you why the creatinine kinase levels is high. You should say the reason. So the questions will be like that. That's what I mean when it says focused on the patient charts. And biostats, you will see at least 20% of the exam on the biostat. The reason behind this is biostat is like for the literature. So once you are a pharmacist and if you want to innovate and know the new treatment plans and that kind of stuff, you need to understand the literature. So that's why they ask a lot of questions on biostat. So here, unlike FPGA, where they will ask the basic questions about the case control studies, mean, median, mod, here they go in depth and they give you let's say they'll give you an actual study that's published, and they will ask and they will ask you and they'll give you the results as a question. and they will ask you to interpret the answer. That's how the questions will be in the biostat. And math, you will see at least 30% of math and 20% of biostat in NAPLEX exam. That math is also mostly oriented towards the treatment, like doing the, I'll go more on math on the next slides because it's really important. And next, all the questions are based on treatment and patient safety. They will only ask you the questions in such a way that, will you keep the patient alive or will you ruin his treatment? That's how they will base the questions on. And also the other thing, you also have to know about the brand names. That's one of the tricky part because we come all the way from India and we will not be familiar with the brand names and the drugs they specifically use in United States. So you should know about that. That's kind of tricky part as well in the NAPLEX. And moving on, NAPLEX is unlike FPGE where it has 4 areas. NAPLEX is very simple and straight. It's only 2 areas. The only thing is safe and effectiveness of pharmacotherapy, where you will study a lot on therapeutics. So if you are good at book Dipiro, then you are really good. And let me also show you a book, something called, it's RX Prep. This is your book for the NAPLEX. So it's RX Prep. So this is kind of 1500 pages book, and this is like a pharmacist Bible. So you will, if you are thorough in that book, you will know about the patient safety and pharmacotherapy and its health outcomes. And on the pharmacotherapy, you will see at least 67% of the test in NAPLEX. And coming to the area 2, it's the here they will ask you a lot about compounding, like in-depth compounding. You should really know about how to prepare the non-sterile products and the rules and regulations. Like you have to go through the United States Pharmacopoeia. There are 3 chapters in United States Pharmacopoeia. They will go in-depth in there. Those chapters are 797, 795, and 800. So you should definitely read those 3 chapters in United States Pharmacopoeia. It's available here in United States. I'm not sure if it's available in India. And there will also a lot of questions about dispensing and administration, like administration in the sense they will ask questions about the infusions, IV bolus. They'll go in depth in here than FPGE. FPGE is like a fundamental. In NAPLEX, they'll go like really depth. And they'll also ask about provision of healthcare products. This is where the over-the-counter products comes. So that's all about the NAPLEX. And in area 1, you should know more about obtaining the patient information, interpreting the lab values, assessing and evaluating. And you should develop individualized treatment plans and taking into consideration many things. You should consider the patient's age, his comorbidities, and his other dietary specifications, allergies, many things. So this is where you develop and implement individualized treatment plans, and you will also assess and modify individualized treatment plans. I'll go in depth about this individualized treatment plans in the coming slides. That's all we will discuss about. And next, finally, advocate individual and population-based health and safety considering. This is population-based. Again, it comes under vaccinations. Here they will ask even about the vaccination storages, how the vaccine is created, like in depth. For example, they'll ask you what vaccines will have thiomersal, the product in vaccines which causes birth control defects. So like that, so on and so forth. They'll go really in depth in NAPLEX. Next, coming to the area 2, this is where you will see a lot of calculations. So they will ask you about ratios. They'll ask you about dosage form calculations. Let's say, for example, a doctor will give you doctor will just tell you prescribe the amoxicillin to the patient. So you would have to go through the guidelines and see the patient age and consider, let's say for a pediatric patient, you should give 1 to 4 megs per kgs per day. So like 1 to 4 milligram per kilo per day. So like those calculations, and they will stress a lot on total parenteral nutrition. So I'm not sure how I don't think we will see a lot of total parenteral nutrition questions in India, but here they will ask you about carbohydrates, proteins, lipids, and their calories. Like let's say, for example, a patient is taking D5W, like dextrose 5 in water. He will ask you how many calories will the patient get from that saline bottle. So for example, let's say one molecule of carbohydrate will give you 4 kilocalories. One molecule of fat will give you 9 kilocalories of energy. So that's something about the total parenteral nutrition. And they will also ask you a lot of questions on the body mass index, body surface area. Body surface area is really important, and they will stress on that because a lot of the oncology prescriptions are based on the body surface area. Let's say, for an example, I can give you doxorubicin. You might be aware of it. For doxorubicin, you have to calculate the dose on the body based on the body surface area, and it has a lifetime cumulative dose of 400 milligrams. So you cannot give a patient more than that in a lifetime. Once you reach the threshold of 400, that's it. You should stop doxorubicin for his entire life. So those questions, that's what I mean when I say calculations, not like simple calculations. So they'll go in depth on that, and they'll also ask something about acid-base calculations, basic metabolic rate calculations, total body weight, all those stuff. You will see all the questions from that. And compounding sterile and non-sterile, here they will ask something about master formulations, where we keep master formulations for hormonals, for patient specified treatments. You should know how to compound them, and you should also now know all the practices for sterile and non-sterile compounding. If you are working in a hospital, you should pass a membrane filtration test or finger glove test in order for you to compound sterile products. So if you don't pass the test before you compound the sterile products, you won't be eligible to work in a hospital pharmacy. So you should know all those things. So compounding, they focus really a lot. And reviewing, dispensing, administering of drugs, of course, that's the key, and that's the main job role what pharmacist does. Moving on to MPJE, it's a multi-state jurisprudence examination. So this is something you choose for a particular state. So let's say if I take my MPJE in Texas, so that exam is only in Texas. If you are going to move to New York or New Jersey, you have to take the MPJE from that state again. So that's what I mean to say. Choose a state for which you are seeking a licensure. The hardest MPJE exam is for California, because California is a state where you are half a doctor. So in California, you have a prescribing authority. Like you can prescribe the meds for your patients who walk into your pharmacy, except narcotics, scheduled drugs, where there is a chance of abuse. You cannot prescribe those, but except that, you can prescribe all the antibiotics, diabetes medicines, and everything in California. So that's where they will combine the federal and state specific questions. And the key is here to know the federal law more, because even the state has a specific laws, they will go based on the federal. So it's like a combination of both federal and state specific questions. And I'm not able to put the content in the examination here because MPJE syllabus varies from each state. So you have to go through the federal law, and you have to know also about the individual state where you are going to be licensed. So this is basically an exam on pharmacy law. It's not tough exam. This is the easiest exam in all the steps, but you still have to know the laws, because to protect your own back in the pharmacy. Because in United States, here the patients have a right if you do a mistake, they have a right to sue you, or they can take you to the court and you will be liable for that. So it's better you know all the pharmacy laws and everything, and you should strictly follow them in your work. That's most important. That's the reason they want you to pass this exam. And moving on, now, coming to the pharmacist job responsibilities, most of the job responsibilities that are covered by Canadian speaker are similar to the American pharmacist as well, because most of the Canadian and American pharmacist job duties are same. Let's say if I'm the pharmacist in United States, if I want to move to Canada, I just have to clear a law exam in Canada, and whatever the state I'm moving to Canada. So that's why I'm not going to cover the dispensing, checking, filling, and all those things here. I'll just tell the other things we do apart from that. So pharmacist is solely responsible for dispensing. So anything that's related to the drug, from the drug you get it from the manufacturer until the drug is excreted from in the patient feces, you are the responsible person for the medicine, all the medications. And you are also responsible for the treatment plans, recommendations, and you will also be responsible for patient counseling, drug education. Let's say in Texas, patient counseling is mandatory for all new prescriptions, but not for the refill prescriptions. Let's say if a patient is going to initiate a therapy, the patient should be counseled and it should be documented here. That's mandated by the Texas state law. So that's about the drug education and communicating with prescribers. I'll give you a good slide. How we will communicate with the prescribers. Profile keeping, we will discuss it on the next slide. Vaccinations and injections. And I also want to tell you about the vaccinations. The key here, in order for you to do the vaccines, you should also be CPR certified. Like the CPR, cardiac pulmonary resuscitation, you should be certified for that. And you should always keep an EpiPen when you are doing the vaccinations, because of the anaphylactic reactions. You should always keep it. Without an EpiPen, you cannot do any immunization to the patient. And injections, let's say in Vega, paliperidone, some patients will come and ask us to do intramuscular shots and subcutaneous injections. So you should be able to do it, and you should also document those. And you should also communicate with the prescriber, and you should send a medical administration record to the prescriber. And it is also better to get the medical clearance before you do those type of injections, which are antipsychotic or blood thinners or anything that's related to intramuscular subcutaneous. Pharmacists don't do the IV. If you want to do the IV, you should go for the residency, which is once you are a pharmacist and then you will go to the residency. There you will be certified for the injectables. Then you can do the IV shots. And next, you are also responsible for your techs and their training. It is your responsibility to maintain the proper pharmacist and technician ratio. And you also have to train them, and you also have to document them. For example, if I have to hire a technician, I have to make sure that they completed their course on Medicare Part A and B, and they also have to complete their course on methamphetamine, and they also have to complete their course on patient safety and customer service skills. These are some of the few, and there are more. So you are responsible for the text training as well, and also continuing education. As I said, pharmacist license will expire every 2 years. So in order for you to renew your license, you have to do CEs, which is called continuing education. So you will have to finish 30 credit hours every 2 years. In that 30 credit hours, you will know about all the new treatment guidelines, everything that's new. from the past 2 years. And then there will be a small exam for that. That it's not even considered as an exam. You can definitely clear it in one shot. And then coming to the drug supply chain, you should keep the pedigrees where you are getting your drugs, and are they accredited by NABP, and if they are expired drugs in the shelves, you will be liable for that if you dispense the expired drugs. So that's where the drug supply chain come from. This is before it's not there, but recently they implemented Drug Supply Chain Act. So we have to keep track where we are getting the medicines and their quality and everything. And next, coming to the scheduled drugs, perpetual records. So we have to maintain perpetual records for scheduled drugs. Scheduled drugs are something called Schedule 1 to 5. Schedule 1 are like street drugs where the cocaine, heroin, those come under Schedule 1. We don't have nothing to do with that, but Schedule 2 are highly dependable narcotics and opioids, and also the dependable drugs like hydrocodone, morphine, oxycodone, oxycontin. They come under Schedule 2 drugs. Those you have to keep a perpetual record. So even one pill counts. Even if you miss one pill, you have to document that. And you have, so let's say if there is a theft or if you lose 100 pills, you have to report it straight to the DEA, where I talked previously about US Drug Administration, Drug Enforcement Administration. So you have to report them and file a complaint, and then they will investigate on the case for the pills and everything. So that's what the perpetual drugs is. And coming to the Schedule 3, it comes benzodiazepines, barbiturates. Schedule 4 is kind of Lyrica, pregabalin, and Schedule 5 is tramadol. So it goes down from highest dependence and abuse rate to down. So that's what the scheduled drugs are. And you will also do something called tamper resistance RX. So you should be, you should know if the prescription is a genuine or not. So there are many ways to identify that. So they will put a watermark, like if you make a photocopy of it, it will say void, void, like that. And there is also something called a thermochromic ink, where if you apply the heat on the prescription, the color changes on the prescription. Once the heat is gone, the color will be regained. And there will also be something called control numbers on the prescription. We go by those also. So that's how this is mainly based on the prescription genuinity and pharmacy liability. So you are liable for the pharmacy, everything, even the registered techs does a mistake, they'll be working under your supervision. So you will be liable for them. Even I have my own pharmacist liability insurance to protect my back, because in mistakes anyone can do it, and the patient have right to come again and confront you. So you will have your own insurance for that, so that you don't have to bankrupt or lose your bank account. So that's why you will have a separate insurance for your pharmacy profession liability. So that's what that is. And next, moving on. Okay, this is, in this slide, I was talking about profile keeping. So this is how we keep the patient profiles. So this is the RX number. So we give the particular number to each and every prescription, and the fill dates, drug name, quantity, how much quantity we filled, how many refills it has. This is where the plan, who paid for it, the insurance, how many days it's going to last, the amount. RXT is like transmitted, so it's transmitted through their insurance, and this is in green. So in green means I verified these prescriptions and these are ready to be dispensed to the patients. So this is how we keep the patient profiles. And this is ERX, it states for electronic prescription. Nowadays, most of the doctors are prescribing electronic prescriptions. just to keep the genuinity in the prescriptions. Here, there are a lot of people who fake the prescriptions, and they'll bring you the fake prescriptions into the pharmacy. You should be able to identify those fake prescriptions for narcotics, opioids, and benzodiazepines, barbiturates, everything. And you should be able to stop them. And that's why the NABP and state boards started this electronic prescribing. So we will get everything from the doctor straight to our computer. And I have to, this is the prescriber's name, and I cannot show the prescriber name. And this is the pharmacist who dispensed it. It's my initials, and then the adherence. So how much adherent the patient is with the drugs. So this adherence is calculated based on the refills patient has and how frequent the patient is refilling the prescriptions. So based on all those, we will give the patient the adherence rating. I try to keep my patient always adherent. I'll always do phone calls to them and ask them to take it in a right way, be adherent. If they have any problems, we will give them the drug education materials, and we will give some reminders to take the medicine, and we will also do the pill boxes. Not we, but we will have the text to do that, like the blister packing, like unit dose packaging for the patient, so that the patient don't miss their dose. And this is one of the typical example of a patient. He's actually a pediatric. He's the patient I'm working right now. So this patient is a cystic fibrosis patient. He has also an epilepsy. This patient epilepsy is also kind of weird. I'm not sure if you guys heard about it. It's called Less syndrome, Lennox-Gastaut syndrome, which is a kind of a special epileptic disorder. So that's where this Banzel is prescribed. If you see Banzel, this is specifically, it's called Refunamide. That's the generic name for it. That's why you have to know the brand names. You will come across a lot of brand names. So Banzel is the brand name, and the generic for it is Refunamide, and it is specifically treated for less associated epileptic disorders. And lamotrigine and topiramate, if you all can see it, they are used in epilepsy, and he also has some movement disorders. So that's why they prescribed benzotropine. And coming down here, it's ED-APAP is nothing but acetaminophen. Cystic fibrosis patients, they always have fever. So that's why the patient want to keep him on the acetaminophen. And they will also have a lot of problems related to the pancreas and liver, because cystic fibrosis is a disease caused by pancreas. And also I can tell you, this is gene specific. So cystic fibrosis is caused by CTFR gene. Whoever the pediatric patients who have those genes, they'll be diagnosed within 2 years of their birth. So that's where the genetics come again. So he prescribed the acetaminophen for the fever. That's one of the symptoms for cystic fibrosis. You know, to protect his liver from free radicals, he prescribed acetylcysteine, and ipratropium is a bronchodilator to help him from breathing, and budesonide also for breathing. And coming to the pulmozyme, this is something brand name, and the generic for it is Dronase alpha. This is specifically a mucolytic agent, which in cystic fibrosis patient, the main problem is they will get a lot of mucus in their airways, and that mucus will make hard for breathing. So this pulmozyme will help them to reduce that mucus levels. That's what this pulmozyme does. And ipratropium is also for breathing, and infection is one of the cause in cystic fibrosis. That's why the doctor prescribed meropenem, which is a gram-negative antimicrobial, and that's the reason he also prescribed him the antibiotic. And then scopolamine patch. Most of the cystic fibrosis patients, they will keep drooling. So like the saliva will come out of their mouth unknowingly. So doctor prescribed him scopolamine. So scopolamine comes as a patch where we put it behind the ear. So that helps the patient from drooling. and polyethylene glycol he prescribed for just for asthmatic diuresis. So this is, and if you can anyone tell me there is something that doctor is missing for this cystic fibrosis patient? Can anyone tell me the missing drug in here? Okay, I won't stress more. I won't stress. He's missing something called hypertonic solution. So basically this pulmozyme will inhibit mucus formation, but the formed mucus should also be sent out. So the hypertonic solution, saline, should be prescribed so that he can, that mucus will run down. So that's missing in this profile. That's what I'm working on. I have to submit to the doctor as a recommendation in coming week or so. So we will see if he approves or not. So this is what I mean when I say profile keeping. Okay. Next, let's move on to the next slide. Okay, this is drug utilization review. This is what we do with the patients when we are dispensing a medication. This is a small example between the interactions between the patient's chat. So the patient liked grapefruit juice and he's also on ranolazine. Ranolazine is something used for angina. So, and it is a nitrate derivative. So taking grapefruit juice with ranolazine is a moderate interaction. So this is the screen that we will see in the software, and it will tell us the plasma concentrations and pharmacological effects of ranolazine will be increased when you co-administer with grapefruit juice. I will tell you why and in the next. Atorvastatin and ranolazine. So atorvastatin is for cholesterol and ranolazine also she is taking for angina. And there is also a moderate interaction. I don't want to put a major interaction because major interactions reveal some patient confidentiality. So I just have to do the moderate. So for these interactions, we will give them a warning about the pharmacological and toxicological effects of atorvastatin. This ranolazine is an inhibitor. So what inhibitor is like enzyme inhibitor. So these enzyme inhibitors, what they does is they go bind to the enzymes and they inhibit the enzymes. So this atorvastatin will be free in the body. So it will have an increased pharmacological actions and concentration in the body because it's not binded to the enzyme. So that's what the warning is. And because of that, the patient might get rhabdomyolysis, myopathy, and muscle, many problems that's related to muscle because of the atorvastatin. And also coming to the Renexa is, if you have to see, it's a CYP3A4 enzyme inhibitor. That's what it basically says. And management. In most cases, no additional precautions are needed until and unless if patient is experiencing any symptoms, because this is just a moderate interaction. And we should, for everything you say, you should have a rationale. Like you should support your own answer. So you can also give an example for the patient, saying that we saw a study on an 86-year-old female who developed myopathy with a serum creatinine kinase concentration of 1875 units per ml within 1 week after addition of ranolazine to her treatment regimen containing atorvastatin. And renal function, they checked the renal function and it was unchanged, and atorvastatin and ranolazine were stopped due to the myopathy. Signs and symptoms of myopathy improved within a month. So this is what the drug utilization review is, what we does every day with the medicines. And next, coming to therapeutic recommendations. When I'm talking about NAPLEX, I was talking about the recommendations made by the pharmacist. So these are the recommendations, how we communicate and how we interact with the physicians like doctors. and healthcare professionals. Let's say I have a patient, like X and X patient, and so I'm going to tell the doctor that I have recently reviewed the medications for this patient, and if appropriate, please approve the following recommendations. And you have to put your name, because in the same hospital there will be multiple pharmacists working, so you have to put the name which pharmacist recommended that recommendation. And now you have to tell, and we will tell them what is the recommendation. So based on the prescription records from the patient appears to have heart failure. So I might see some, in the patient chart, I might see some drugs which he is taking for the heart failure. And with the patients who have heart failure, they will benefit from taking beta blockers, especially carvedilol, metoprolol, bisoprolol. When I am studying my NAPLEX, metoprolol succinate, which is an extended release tablet, we call it as metoprolol succinate is success of heart. So that's how we say it. So and carvedilol, and we recommend these drugs to the doctor. And we will also tell the doctor what's the rationale behind the recommendation. We will tell them that there are guidelines published by American College of Cardiology and American Heart Association. They recommend that all patients with symptoms of heart failure and experiencing in the past, and also have reduced left ventricular ejection fraction. This is something that's in deep. So, but I would just say that who have symptoms of heart failure in the present or past should be on a beta blocker. Beta blocker therapy has been shown to lessen symptoms of heart failure. They decided this based on a lot of studies. That's why they started implementing this as a guideline for the heart failure patients. And for the same patient, I also see one more recommendation, because the patient is taking both opioids and benzodiazepines. If you take both opioids and benzodiazepines together, it will cause depression, sedation, and opioid related doses. So, and our job is to just to let the doctor know this is what is going to happen with the treatment chart and the patient medications. And it's up to the doctor if he is going to approve this recommendation or not. So that's for the recommendation 1. Let's move on to the recommendation 2. And in the recommendation 2, the same thing for this patient. I recently reviewed the medication. This is where the prevention comes. This recommendation is for the preventive measure. So with this patient records, I see that patient is diabetic and patient is also 40 years older. So, and I don't see a statin therapy like atorvastatin, rosuvastatin, simvastatin. I don't see it in her profile. So it strikes in my mind that she need to be on a statin therapy, because the patients who are 40 years and older and are diagnosed with diabetes, they have a chance of ASCVD, which stands for atherosclerotic cardiovascular diseases. So in those patients, as a preventive measure to prevent the cardiovascular diseases in future, we will recommend a statin therapy. So what I did, I just send it to this doctor that it's better to start a statin therapy, and doctor will decide to whether to put him on a high statin therapy, moderate statin therapy, or low statin therapy. And it's up to the doctor if he agrees to this recommendation or not. This is an example for prevention. And next, moving on to the next slide. Okay, these are the examples for cost-effective alternative recommendations and initiating therapy. So, okay, this first example, I see a patient is taking one of the branded drug, which is called Mirbitric. This is used for overactive bladder. So the older patients who have bladder problems like urgency to urine and leaking problems, here most of the adult patients, they even on adult diapers. So that's why they prescribe these overactive bladder drugs. But the cost-effective alternative in this is this Mirbitric will cost them around $400 a month. But if they can change it to oxybutynin, which is very cheaper, and it is available for $10 a month. So it's a great price difference between those two drugs. And patient doesn't have any insurance, and it's better for the patient to go for the cheapest drug. And if you see, 25 milligrams of mirbitric is equivalent to 5 milligrams of oxybutynin. The right choice would be here is a oxybutynin 5 milligram ER, because this mirbitric is an extended release tablet. So 25 milligrams of mirbitric will be equivalent to 5 milligram extended release oxybutynin. So but it's up to the doctor to take the cost effective recommendation or not. And doctor might also send me a reason for refuse. So, and he might put a reason here stating that oxybutynin will cause blurred vision. That's the reason I'm not able to do the, I'm not able to prescribe the oxybutynin. And the same thing for tolterodine, 4 milligram, it causes blurred vision, and mirbitric, there is no blurred vision. If that's the rationale, doctor will refuse your recommendation. But if doctor can change it and patient doesn't have any problems with the blurred vision, she will have a best cost effective alternative. So that's how the pharmacist plays a key role. And patients really develop great relations if you help them in this way, because the drug prices in United States are skyrocket. Believe me, they are like crazy high. And in the same, for the same patient, and this is the recommendation for initiating a therapy. So I see that this patient is taking short-acting SABAs, like short-acting beta agonists, like albuterol. Let's say in United States, there is something called rescue inhaler. That's called rescue inhaler. That is called ProAir. Whoever is having asthma problems, they will keep that in their pocket, so they use that. I see that this patient is using more than 2 days in a week. So she is using for at least 4 to 5 days in a week. So patients, whoever are using short-acting beta agonists, according to this National Heart, Lung and Blood Institute, patients using SABAs for more than 2 days, a week of symptoms, we generally start them on the steroids, inhaled steroids, as a maintenance therapy. So I recommended the doctor saying that it's good for the patient to start on the QVAR. QVAR is beclomethasone. It's an inhaled corticosteroid. Flovent is fluticasone. Asmanex is mometazone, and Pulmicort is budesonide. So that's what, if they start them on the inhaled corticosteroids, it will help them in preventing the future problems that is related to respiratory. And next, moving on. So that's what my thing is. Whenever you recommend the doctor, you should have a proper rationale, and you should tell them and show them the proper guidelines why you are recommending this. You cannot simply recommend because you want to sell something in your pharmacy. You cannot do that. So there should be something rationally. Next, moving on. This is a typical telepharmacy screen where I am sitting here in my pharmacy, and this is not the actual patient. She's just my technician. I just asked her to take off her gown and stand as a patient so you guys all can see it. And I took a same example for Renexa, Renalazine, which is used for angina. And these are the warnings I will tell the patient. And these two interactions we already discussed in the drug utilization review. And I will explain the patient in this call, saying that it will, if the patient is taking for the first time, I'll tell them it will cause some dizziness and drowsiness. Don't operate a vehicle. And it's also better not to use the heavy machinery jobs while on this medicine. And I will tell them swallow whole, because Ranexa is also an extended release tablet. If you break the tablet, there is no sense in taking an extended release tablet. So we will definitely put a auxiliary label even on the bottle saying that swallow whole, don't crush or chew. And I will also advise the patient saying that it may cause headache, because Renalazine is a nitrate derivative. All the nitrate drugs, also like sodium nitroprusside, those drugs which are nitrate derivatives, they cause a headache. That's the major side effect of those drugs. And I will give a heads up about that. And then I will also let the patient know that check with your doctor or pharmacist while taking any other drugs, over the counter drugs. And I will also suggest the patient not to take the medicine exactly as directed, and do not skip any dose until and unless it is specified by your doctor. So this is how typical telepharmacy works. So I'm not in that location. So I'm just supervising the technician, patients, and everyone through a virtual supervision. So that's basically everything about the pharmacy in India, sorry, in United States compared to India. And next, I'm going to thank you, principal, convener, and coordinators and participants. And I'll be glad to answer all your questions about your United States pharmacist licensure procedure. I think I covered everything. If you still have any questions, I'll be glad to answer it.
Thank you very much, Tarun Krishna, giving your in details about every step to get
Sir,
as.
did I go so detailed? It is so boring for you all?
No. It is giving, you are giving everything, like every step, how we need to cross, what are the obstacles are going to be there. It's really very nice.
Yes, sir. Because they have to know the difference, how the pharmacy works in India and United States. It's a lot. I see a lot of difference between that. So I just want all the students to be aware of it.
Yes.
I just want the students to be aware of it. Yeah.
Yes. Thank you. Sahiti?
Yes, sir.
Are there any questions from students' side?
Yes, sir. Yes, sir. It was very nice and in detailed information, Tarunana. It was really good because the students will get to know what are the subjects they have to concentrate while preparing for the exams, because many of the students will think they have to prepare only for therapeutics. They'll feel that.
No. I'm telling you, all the subjects you have from Pharm D first year until you graduate your Pharm D sixth year, each and every topic is important, and you will see questions on each and every chapter and every subject in FPGA.
Yes, Anna, because many, especially we all know that medicinal chemistry and the maths are the most of the subjects which students doesn't want to concentrate. But after listening to the session, I hope they'll try to concentrate on that subject also.
No. Medicinal chemistry is heart of FPGE. You will see a lot of structures. You will see at least 30 questions on the structure. They'll just give you a drug structure, and then they will ask you what this structure, what is this drug and where is this used. So you just have to see the structure and tell the drug name, and you just have to tell. I already gave you the examples, right? So that's how it's going to be. You'll see at least 30 questions on medicinal chemistry structures.
Yes, and that's what's helpful, and I'm thankful for the recommendation of books also, which will be helpful for the students to start learning.
Yes.
Tarun sir, it was really good, ba.
Thank you.
It was totally impressive.
Want the students to be benefited from it. That's
it was really impressive. Really impressive.
Thank you.
And we have, for example, attended so-and-so workshop or training program regarding licensures. We have convened for the students. But this much depth, I think none of them have explained. And it was realistic, very realistic. And it was not that so much that you were speaking the very advantageous level of getting into USA. So to what extent the hardships has to be there, and how much they have to come across. It was very, I won't say, it was very impressive. I think our students have got benefited a lot out of it.
Thank you so much, sir.
Very crystal clear it was.
Thank you, sir. So basically, that's what a pharmacist does here, sir. He is liable of many things. I always go to work every day and I try to protect my license.
Yeah, that's what.
Keep the patient safe. Here, if you do something wrong, they will put it on a disciplinary action. And if you do the same mistake again, that's it. You will lose your license. So you should be very careful with that. Yeah. After going through all these steps and clearing the exams, tough days, if you lose the license, there is no sense. Yeah.
Whatever we say is pharmacy profession is multitasking. That is the thing we say like
Yes,
in a definition.
Exactly.
But the realistic in a way, where in US it is practiced, I think it is a multifaceted genre for you. And
Yes,
it have more and more, what you can say, profitability in terms of fiscal is good. But to keep up with it is very difficult, I think. So the regulatory or the federal laws are that much
That's why
stringent.
you have to do the continuing education, sir. That's why they want you to do the continuing education every 2 years. And you have to take a small exam to renew your license. That's not a tough exam, but you just have to know the basics and new innovations in treatments. Yeah, that's where they concentrate.
Very real. And one more thing is how much you can compare your recommendation of curriculum-wise, an Indian PharmD curriculum. To
Sir,
what extent?
mostly it's the same, sir.
Yeah.
Whatever we study in India, you will see everything. Apart from that, you will learn a lot about American stuff. Like I told you, Medicare, Medicaid, like Medicare, Medicaids, they'll specifically ask questions on that. You will never listen the word of Medicare, Medicaid, HMOs, PPOs in India. Those things you will know once you start preparing for FPG here. So that's
I want a very sincere suggestion from you regarding any what we can say a transition level of teaching methodologies. Because we teach, maybe in a very bookish way we may teach, or experimental teaching we may do. But what is a realistic teaching? What we have to follow?
Sir, I would definitely say that bookish is nothing, sir. I studied a lot of books for the exam. They won't ask any straight questions from the books. They will just ask if a patient is walking into the pharmacy with low blood sugar and he fainted down in your pharmacy. What is your first step you're going to do? So that's how they will ask the questions in the exam as well. The first, it might be in multiple choice. You can select, you can give him a cool drink, like I would say, we call it soda here. Like we'll just give him a Pepsi or a glucose tablet, something like that. We do that first, and then we call the emergency 911. So that's the emergency thing. So the questions will be based on that. So practical, like you should know the bookish knowledge, but you should know how to apply that knowledge in the real world. You understand, sir? So
I understand, but the thing is,
that's what you should teach the patients as well. So sorry, the students as well. You should teach them that not only, like, let's say if you are teaching something that's related to diabetes. So once you are done teaching about diabetes, students should be able to treat a patient. Like if once he go back to his house and if his mother is diabetic, students should be able to give a suggestion. Like let's say for metformin or anything, sir, anything it is. So he should be able to treat. That's what it is. And he should be able to give some recommendations. That's the thing we should learn, sir.
Yeah, that's what I'm able to understand. But I want a more inculcative way by which it can be strategically reaching a student. Why? Because, for example, I take a case in therapeutics, or I take
clerkship and internship, sir. Those two are the key, sir. If you when you're doing clerkship and internship, you will go through the wards and you will see the actual data from the patients and from the prescription charts. There you should learn how they are prescribing the medicines. And there you should learn what changes you can do in order for the patient to be better treated. And the main key is to work on patient charts. That's what we do all day, sir. What we do is look on patient charts, find the best available strategy for them. That's it. I think I showed you a slide about the patient profile. So that's how that's the screen we see every day for each patient. And I look at the screen and I will see, okay, what's missing in here? Like that patient is missing a hypertonic solution, How, so the student should come back and see about cystic fibrosis, what is missing from the treatment guidelines, and he should go and recommend that. That's how it should work. Did I answer your question, sir?
Yeah, it is clear. But
Yeah, simple, sir.
one more, yeah. No, I mean, we are, as a faculty, we can get through whatever you say. From the point of a student, for example, they read a subject, a section like infectious disease. In which area this particular thing, a pharmacist's role is more imperative. That way, they have to be, thought process has to be developed. So the thought process.
There is no such a way, sir, because there are many topics in pharmacy. Like I cannot go in one specific way. Like you just have to do it this way. I cannot say it that, because there are multiple topics and it's a vast syllabus, sir. So the only key for a student is to know the actual meat, like what, like starting from etiology until the assessment. He should know everything, basically everything. So that's how they should learn. And I would say that not only you will not learn that when you are a student. If you take my example,
Yeah.
I didn't learn all this when I'm a student, to be honest. I learned this when I'm preparing for my boards, and I learned all these when I'm doing my internship. That's when I learned all these things. So your internship is very, that helped me a lot here. After doing my internship and after clearing the NAPLEX exam, I felt very confident that now, okay, I can treat a patient. If a patient can come to me, I'll be more than confident to treat him. Yeah, that's the thing you need, confidence.
Sahati,
Yes, sir.
you can start posing the questions, ma.
Yes, sir. Tarun Amma, just now you have explained the importance of internship. Can you just explain what are the day-to-day activities you'll be doing during the internship in US?
You will be doing everything what pharmacist does. You are a pharmacist while you are an intern, but you will be under a direct supervision of pharmacist. That's it. Let's say if a pharmacist step out, now you are no more intern. When there is a pharmacist with you, then you are a pharmacist. That's it. You can do anything what pharmacist does.
And there are few questions. Yes. One is apart from registered pharmacist, what are the other opportunities? Though Avnindra Anna has covered few. So
that's it. I'm not going to go on those again and again. Whatever Avani covered is more than enough opportunities in United States. I guess he covered most on data management, SaaS, and everything. That's pretty much it. That's all you have here as well. And I really don't have much knowledge on those, because from the day one while I'm here in United States, my focus is on pharmacist. That's what I want to be. So I didn't really get much information on that. So those questions you can ask Avani. He will be more than glad to answer you.
And regarding
Mohan sir.
Yes, sir.
This is Avnindra.
Hey, good morning, Avnindra.
Good morning, sir. Good morning, sir. I just want to quickly comment on your question. So what can be done to improve the standards of Indian students in pharmacy?
Yes,
although you are going to the extreme levels to explain everything better to them. So I think, sir, whatever Tarun or I gained knowledge, it was just because of the exam. When it comes to teaching and if you're dealing with the students, they're always lazy. I mean, sorry to say that. I mean, I'm trying to generalize, but even I came from the same situation. If we don't have the fear of the exam, we really don't study, especially the boys. So I think your teaching methods are pretty advanced, and you're always getting the knowledge of off the art. I mean, whatever the advanced technology or whatever the advanced information you have, you are gaining it. But the thing is, the students are not taking it up. But the only way that how we can make them to take it is put it in the examination. Like we should get rid of those traditional examination procedure. That's the only way we can get them to the right knowledge. If we start the way of making our exams in a case analysis format, that will be the gold standard for students to learn. I think that's the best.
Thank you.
Thank you, Avanindra.
Sir,
Avanindra, thank you. Thank you for joining us.
No problem, sir. Yeah.
Tarun, what Avanindra was saying is, earlier it was said by Avanindra, there is a possibility of doing internship by the Indian students in community pharmacies at America. Is there any possibility?
Yes, sir. There is always a possibility, sir, but it's not that easy. But there is a possibility.
Okay.
That's what I can tell you. It's hard, and you need to have support from healthcare professionals. Like you need to maintain some relations. That's why I'm saying it's hard to get a job as an intern. That's why I told you start as a technician, and then once you are a technician, they will know about you, and they will know about your worth, how worth you are, and then they will be happy to offer you an internship. That's one of the shortcut to get the internship. I have 4 friends who are from India. Her name is Madhuri. She is from PSG College. We both did these steps together. She started as a technician in Walgreens. So first she applied as an intern, and then she was not able to get that job. And then she applied as a technician. So they did give her the job, and she did show her ability in the work, and they did understand how helpful she is in the pharmacy. And then after she have all the clearance from the exams and the boards, and then they offered the internship. That's one way. And the other way, if you know someone, that's even better, who are a pharmacist here, they will definitely help you. They will have their contacts. That's one way. And the other way is, if you know a doctor, you can ask the doctors, and you can work under a doctor as a physician assistant. That's one way. Or you can also work as a hospital tech and then move to the physician assistant. That one way. If you want to reach there are many ways, sir, but they are hard, and you should put your efforts on it.
Okay, thank you.
Yes, sir.
So I think you can get into questions.
Yes. Tarun, one more question. Like you have explained how to get internship. Like you have explained that we can take a shortcut as applying for a tech, and then we can go for internship. So whether there are any different approaches if one wants to pursue a career in community pharmacy and hospital pharmacy, whether there is any difference in approach, or it's the same approach for both?
It's kind of same approach, but the work will be a lot different. In a community pharmacy, the intern will only be working on discharge prescriptions. In hospital, you will be doing like on-site dispensing. So the work will be different, but approach will still be the same. And also one of the easiest way is to find a non-profit organization. They will be they will provide you a job, but they won't pay you. But if you want to be a pharmacist, you still have to work without any salary. That's one of the shortcut as well, working without a salary. If you want to volunteer, then they will hire you.
Okay,
but they won't pay you. In hospital, yes.
Tarun?
Yes.
Tarun?
Yes.
Is there any possibility of getting MOU with community pharmacists, with a college where the students are ready, interns are ready, something like that?
I don't think so.
Okay.
I don't think so. That is possible, but there is nothing wrong in giving a try. But to my knowledge, it's not possible, sir, because here they have to see the students first and their abilities, and then they will choose them, sir. But honest. I'm not sure about the other ways, but to my knowledge, there are no such things like that.
Sir, just to answer your question, so as I said, universities, they don't encourage community pharmacists in their premises because most community pharmacists, their objective is to make profits and they're into a complete business. But universities, they always go for independent pharmacies. They're entirely, they're a little bit service oriented, I would say, though not completely business oriented. And if we can have such MOUs with the university where a hand of these independent pharmacists are also brought in, I think that would be a better option to explore, sir.
Sir, you can do one thing, sir. There is some pharmaceutical associations here in United States. And some of pharmacists from India are members and some of them are even presidents for those associations. So they have they'll have a wide, they will know a lot of community pharmacies. You can talk with those associations. One of the association is like Texas Indian Pharmacist Association. So in that association, there are almost around 200 to 300 pharmacies. So you have to find an association like that and see if they will accept your proposal.
Okay.
Yeah.
Thank you.
Yes, sure.
Tarunana, there was a question from Nirali. They are asking whether after clearing PBC exam to enter into USA, what are the formalities for that?
Can you say that again?
After clearing PEBC, what are the formalities or exams they have to clear if they want to enter into US?
Oh, okay. If you are a pharmacist in Canada, if you clear PEBC, that doesn't count anything. You have to start again from the first step. But if you are a pharmacist in Canada, there are some states. Again, it depends on the state. Like let's say if you are a pharmacist in Canada and if you want to move to Illinois, you will be able to move. You just have to clear the law exam. But if you want to move to Texas, no, it's not possible. You have to clear the NAPLEX and MPG.
Okay.
Because Texas is more conservative.
Did I answer your question?
Yes, Anna. It is only possible. It is only applicable for few states, but we have to clear the examination.
The main thing is you have to clear the law exam again, wherever the states that is applicable. If the state is not allowing you to be a pharmacist, even though if you are a pharmacist in Canada, then you don't have to clear the FPGE and TOEFL, but you have to clear the NAPLEX and MPGE in that state.
And one more question is regarding the telepharmacy. Because in your profile also you have mentioned that it was somewhat related to that. So can you explain more about that telepharmacy?
Telepharmacy, okay, I would say that the Canadian speaker, he said that pharmacists should always be in sight, right? That's absolutely true, but an exception is telepharmacy, where the pharmacist will not be in the site, but he will be monitoring the patients virtually through audio and video. Even I am not able to put the images of the dispensing, filling and checking from telepharmacy because it violates the HIPAA law, which is called Health Information Privacy Protection Act. So that's the reason I am not able to show you all those. But I will be in my pharmacy, but I'll be checking the prescriptions in the telepharmacy through the pictures, through the counseling point, through the video call, like that. That's pretty much about telepharmacy. That's it. The only thing is pharmacist won't be there, and technician should be have at least an experience of 2 years in order to work in the telepharmacy.
Yes. Thanks, Anna. And there was one more question, like whether we can apply directly or whether we can directly attempt for NAPLEX after completing PharmD in India.
No, you cannot. You have to go through FPGE and TOEFL. The only way you can skip FPGE and TOEFL is if you do PharmD in United States. If you can come to United States and do PharmD post-baccalaureate course, same like India. If you do that here in United States, then you can skip FPGE and TOEFL, and then you can go straight to NAPLEX and MPGE.
And what are the requirements for applying
Yeah.
postal baccalaureate in US, Anna?
Same thing, you need to have good GRE scores, IELTS scores, and it's very hard. You'll have a lot of competition. That's why most of the students don't do that. And it is very expensive. It will cost you somewhere between $40,000 to $80,000, depends on the university you are going.
Okay.
That's per annum? That's per annum, Tarun?
Oh, that's for the entire course.
Entire course. Okay.
Yes. Yes.
Yes. Thank you, sir.
If you are going to a not reputed university, then you will end up paying $40,000. If some university like Massachusetts, which is heart of pharmacy, and Philadelphia University, if you want to go those universities, then you will end up paying 80,000, even 100,000. No wonder. Yeah.
And you have explained that you have taken a course and you have got the time for the preparation, and you have done the internship with the work permit you got after completion of the course. So whether there are any chances, like if the person doesn't want to go for a study, they just want to concentrate entirely on the clearance of examinations, whether it's possible for a student?
Yeah, it is possible if you come here and marry an American girl. And if you are an American citizen, then that is possible. If you are not a citizen, and if you are coming here on a visiting visa or student visa, then it's not possible because you won't have a work permit. You need to have a work permit to work as an intern.
So approximately there was a question regarding the expenses. So approximately how much the expenses will be there for clearance and everything?
Just to clear the boards and just to finish the steps, it's not expensive. Like FPGE will cost you around $1,200, and TOEFL will cost you $200 for each sitting, and NAPLEX will also cost you around $1,200, and MPJE will cost you around $600. Exams are not, it's expensive if you convert into Indian rupees. Like $1,200 will be around 1 lakh or 90,000 rupees. So that's how each exam will be, how much each exam will be. And there are also some tutors who give the training for these exams. If you choose them, they will charge you around $1,000, something like that. But I would say if you can read all the books I said, like APHA, FPGE review, CPR, Lippincott, RX prep, and individual state books, that's more than enough, I would say. And you will obviously have your knowledge from the PharmD degree. So it should be more than enough, I would say. But if you think you need guidance and support, it's always better to register for a course.
Yes. And there was one more question about suggestions to prepare for TOEFL.
TOEFL is nerve-wracking, I can say, because TOEFL, the only tough thing is you have to pass each and every section. So I would say you should be really, really fluent in speaking. Getting 26 in speaking and 24 in writing are the toughest things. I'll say toughest things, but it's not like you cannot do it. It's doable, definitely, but you need lots and lots of practice. The only thing I did from the morning I wake up to the night I sleep, practice, 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 and again wake up and practice again. That's it. That's all you should do for TOEFL until you are perfect in speaking and writing. I'm specifically concentrating on those two because you need a higher band scores on that. Reading and listening, we can do it. Indians, I never saw Indians having hard time on reading and listening sections. Always Indians will have hard time, especially on writing, because in Indian curriculum, we don't write many papers. We write one paper as a formality in 5th year and one paper in 6th year. That's all we do. In here, they focus a lot on writing. I wrote at least 15 to 20 papers in my master's. So that's how much writing is important. So speaking and writing skills, we should develop a lot on those. That's where I have a personal problem on that.
So whether you suggest any books or any websites for mock practices for TOEFL, whether there are any good books for that?
I prepared from the ETS book and Barron's. Those are the two books you should definitely go through. And I did a lot of online preparation. Like in online, you will find a lot of TOEFL tests. Wherever you find a TOEFL test, you just go find it, do it. The two books I personally used are ETS. The ETS is the service who conduct the TOEFL, and they publish one book for the preparation, that book, and Barron's. So everyone might know about Barron's already. So.
And I think many of you are fond of the books you are referring, because there was a question again on suggestions on books for federal laws in USA or on biostatistics.
Don't worry about federal laws while you are in India, because you will learn a lot about those in the last step. In the first FPGA and NAPLEX, they will ask you only preliminary questions, because they also know that you are a foreign graduate. So they will just focus on the basic things like FDA, DEA, Drug Supply Chain Act, Poison Act. Those acts, you will find it in AFA book. I showed you already. So though that's the basic, that basic is, but finally for MPJE, there are federal laws and regulations. I can send you that link to the book. That's very important. And also in state specific book, like Texas state book, whatever the state you are going. For example, for Texas, there is something called Ultimate Texas Pharmacy Laws. That book is really good to pass the Texas MPJE exam. So that's it. I would say concentrate more on the other parts, as I told you, like the microbiology, immunology, biochemistry, physiology, pharmacotherapy, clinical pharmacokinetics, clinical pharmacotherapy, medicinal chemistry, biostat. Focus on those topics while you are in India. You can read those federal laws and state laws when you are here. That's the thing I would say.
Yes, that's all for the Q&A, Tarunana, and we are happy for having you. And
sure.
Can you have for the PPT which you have presented, because it contains a lot of information which will be helpful.
Okay.
So can we have that PPT?
I can give you, but the only thing is I tried to forward that PPT to one of my friend. You see, I did strike the doctor's name and patient name. So here, that's very important. The patient confidentiality and health privacy protection. So if I can take those slides off and I can give you the rest. I know if I take those from the slides, there will be nothing you guys
You can re-edit that. You can remove those slides and you can forward it.
Yeah. Narayana.
Yes, sir.
Narayana.
Yes, sir.
Anyhow, it is available in YouTube.
Recording. Yes, sir. Recording it is there.
Recorded, why you need to trouble Tarun again?
The only thing is I'm just scared of the confidentiality, sir.
Sir.
That's
there will
true.
be more
That's
conflict
true.
will be there.
Yeah, because the patient will have if the patient see her name in YouTube, she will have a right to sue me here for $1 million. I will have to work for my entire life to pay that money.
Yeah, that's correct. That's correct, sir. Tarun, it was good, Tarun.
Okay, thank you.
Tarun, you have explained everything very nicely, elaborately, very clearly. Thank you very much. And I hope that all the participants might have cleared their doubts after hearing your this thing talk.
I wish I covered everything.
Yeah.
I think so.
in the beginning you told that, and at the end I am telling, you have covered everything.
Yes, sir. Yes, sir.
Yeah,
The rest I
so-
don't want to put my hand on it because Avanindra has did everything about that. So
Yeah.
I don't want to touch those.
So, Tarun, on this auspicious occasion, I thought it fit to convey our heartfelt thanks for your good time shared with our participants. And we convey our happiness and gratitude towards your commitment of career roadmap in United States. And sincere thanks to your indebted illustrious management, invaluable guidance, encouragement, and support. And we are really proud to have you as an alumni, and you are a wonderful mentor. And we are really fortunate to have both Tarun and Avanindra. And it was a gratifying experience to have you, both of you, with us. It was a very wonderful session carried over by you and Avanindra. And I wish to place my sincere and heartfelt thanks to both of you.
I'm
And,
glad to be as one of the speakers, sir. I'm
Yeah,
really
sir,
glad.
thank you. Thank
Yeah,
you.
yeah.
Thank you. Take care of your health.
Sure, sir. Sure, sir. Everyone be safe from COVID. The key to success in United States pharmacists is planning and dedication. That's all I will say.
That's it. Thank you,
Thank
sir.
you, sir.
Avanindra, thank you, Avanindra.
No problem,
Thank
sir.
you,
Thank you.
Avanindra.
Thank you, Avanindra.
Avanindra.
Thank you.
Yep, my request and my greetings from Raipur. On behalf of Raipur, I would like to invite you both of you. Whenever you visit, come back to India, please make a visit to college.
Sure, sir. Sure.
Tarun and Avanindra.
Sure, sir.
Sure, sir. Definitely.
Well, because it will be more motivational and to the students, and also for us, it is nearly 5.5 years to get back to you. It will be a finest experience for us too. And you also can teach us. We can learn from you. We don't have any limitations.
No,
We are
sir.
here to.
You taught us a lot, sir. So, yeah.
That's
we
fine,
will
sir. That is
we
the
will
teacher.
always have the-
And now we want to learn from you.
Sure, sir. Sure, sir. I'll
And
always
we
have
want to
that
learn a
pleasure.
lot from you. Why? Because, yeah, sir. Sure, sir. Thanks a lot, sir.
Sure, sure.
Avani, once again, thank you, Avani, for joining
No, no
us.
problem, sir. Yeah. My pleasure.
Avanindra and Tarun, good day to all of you. Thank you for joining.
Thank you, Tarunana, because I know it's a very wee hours for you, but you have spared the time and you have joined for us. And I hope the students, they are not only think about the benefits they'll have after becoming a registered pharmacist in USA, they also get to know what are the hardships they have to face, because
Yes.
it's really hard work they have to do. I hope that they'll understood what the things they have to do, how much dedicated they have to be to in order to be a successful registered pharmacist. I hope they'll
Right.
get to know from listening to this.
Yes.
So thank you so much, Tarunana, for joining and sharing the knowledge and experiences you have.
Thank
And with this, we are going to end the morning session. And thanks, Abhyana, for joining and giving some suggestions from your part also in this day. Thanks for joining. And a small announcement for the participants. The afternoon session will start by 2 o'clock, and career prospects and suggestions in Gulf country. So you can join in YouTube or in Zoom by 2 o'clock. The afternoon session will start by afternoon 2. Thank you. Thank you for
Tarun,
joining.
thank you, Tarun. Be in contact and connect.
Thank you, Ma. Thank you.
Sure,
Bye.
sir. Sure.
Bye, bye, bye.
Thank you,
Avani,
Tarun.
bye, Avani.
Thank you. Bye.
Thank you.
Bye, Avanindra. Bye, Avanindra.
Thank you all for joining. We'll be ending the session here. Good day, everyone.